Professor Bela Goyal from Department of Biochemistry, AIMS Rishikesh, Uttarakhand.
Respected ma'am and dear colleagues, at the outset, I am very thankful to the organizers to give me this opportunity to speak at such a wonderful platform. So, this is the study that we are carrying out. It's a part of study that we are carrying out in our lab on gallbladder cancer, and the title of this presentation is MIR19A Indications for Early Diagnosis and Understanding the Disease Pathogenesis. So we all know that gallbladder cancer is a very aggressive malignancy, and it is one of the most common biliary tract malignancy. And India, it accounts for around 10% of the global burden. And among India also, it is the Indo-Gangetic plains, especially Uttarakhand, which has been considered a high-risk region for this cancer. Multiple risk factors have been identified, and chronic inflammation like obesity, age, gender are there, but chronic inflammation is well known to be associated with the gallbladder cancer, you can say pathologically, but nothing much has been studied as in what is the pathogenesis behind that. So inflammation is a significant risk factor in the development and progression of gallbladder cancer. Two pathways that have come up very closely for the association of cancer with the inflammation per se are NF-kappa B and STAT3. Here in this picture, I want to depict that if you can see here, this is the vessel where cancer, there is a normal stem cell, and when there is an inflammatory niche that is provided by the cytokines, chemokines, or other factors, that is seen to progress to cancer stem cell. Here it is shown, this was another publication where it was shown that these pathways, NF-kappa B, STAT3, they are basically transcription factors whose expression increases with the increase in inflammation, and that result in the cancer progression, which further leads to activation of these that promotes the growth and the proliferation in the cancer cells. Coming on to microRNAs, these pathways, as we were talking about NF-kappa B and STAT3, they are regulated at multiple levels by multiple factors. One of these factors is epigenetic regulation. And in epigenetic regulation, microRNAs, they play important role. MicroRNAs are basically, these are small 20 to 22 nucleotide RNA molecules that bind to the mRNA, target mRNA, and degrade it. It is, and it has been like this is an example of STAT3 pathway, JAK-STAT pathway, wherein as we can see, there are multiple microRNAs which are regulating the various proteins in the pathway, the proteins that may be stimulatory to the pathway or inhibitory to the pathway. So that way, it can be an activating mutation to the tumor. MicroRNA may be regulating it in a positive way or in a negative way as well. In the next one, this is just an example of hepatocellular carcinoma, wherein we can see that microRNA, they play a role converting hepatocytes and then involved in the chronic inflammation and further in the cancer. So there are different microRNAs that may be playing role at different steps in the cancer. And again, NF-kappa B and JAK-STAT3 signaling has been observed to be involved in progression from chronic inflammation to the cancer. So taking these concepts, we planned the study wherein we identified two microRNAs, MIR19A and MIR146A, that were known to regulate the NF-kappa B and STAT3 pathways. MIR146A has mainly been studied in the hepatobiliary cancers, and 19A has been studied mainly in the oral cancers, although we could not find any study in the gallbladder cancer patients. So the study was planned, and total 80 subjects were enrolled, where concurrent tissue and blood sample was taken from the gallbladder cancer patients and cholelithiasis patients, 20/20 each. And for control group in the tissue samples, non-dysplastic gallbladder cancer, we cannot, ethically it is not possible to take a normal gallbladder tissue. So the gallbladder tissue for the non-dysplastic tissue was taken from the gallbladder, which was removed as the part of other surgeries like Whipple surgery or right hepatic resection. For the blood samples, the voluntary healthy controls, apparently healthy controls were taken as controls. So the inclusion criteria for the gallbladder cancer patients was the patients who were aged more than 18 years, and there was FNAC or biopsy proven cases of GBC. The staging was done based on CECT abdomen and pelvis as per AJCC 8th edition. The patients who were previously treated for GBC or were having metachronous or synchronous malignancies were excluded, or with the poor performance status or who did not give consent were excluded from the studies. For cholelithiasis patients, the patients who presented to the surgery OPD more than 18 years with the history of abdominal pain and radiological evidence of gallstone were included, but the ones with radiolation gallstones or who refused to give consent were excluded from the study. For controls, for the tissues, as I already discussed, the gallbladder tissue removed as a part of other surgeries like Whipple's and right hepatic resection, that was taken for the tissue, and for the plasma, the patients the people, volunteers who were apparently healthy, and the LFT was also performed, which was normal, those were taken as controls. Now, after taking the tissue and blood from the RNA, using the commercially available QIAGEN kits, we isolated the microRNAs. These microRNAs then, by using microRNA specific reverse transcriptase primer, we converted, cDNA was obtained, and that cDNA was amplified to understand the expression. So relative gene expression analysis was done using delta CQ method. Reference gene used was U6. 2 to the power minus delta CQ was taken as expression, and it was compared using various statistical analysis. Coming on to results, here I want to point out is the age is similar as seen in other cancers of gallbladder cancer across the world. That is 57, mean was in our population 57.35 years with standard deviation of 8.53 years. And gender distribution is also as per the norms. It is 80% females that we observed in our study. Here I want to say that only the patients presented to OPD when they had abdominal pain. So the first symptom patient observed is abdominal pain. 100% of our patients had abdominal pain. Second point is gallstones. It is otherwise reported that gallstones are present in 50 to 70% or 80% of the patients across different populations. But we observed only 30% of the patients of gallbladder cancer having gallstones. Now the most important point that I want to make over here, if you can see here, that most of the patients, 65% were stage 4 with metastasis. And 75% patients had liver infiltration, making them unresectable. Now, gallbladder cancer, the mean survival that has been reported for 5 years is just 5%. In our study, in our setup, we see that hardly patients survive for more than 1 to 2 years. So that is why this is a research area. This is a cancer which really needs intervention for early diagnosis and understanding pathogenesis so that therapeutic interventions can be done. So this is the result of our microRNA study. So there were 3 groups as we discussed. So there are 4, if you can see in the panel, A, B, C, and D. A is the MIR19A expression in tissues. C is the MIR19 in plasma. B and D are MIR146 expression in tissue and plasma, respectively. If we can, I would like to point out, if you can see, it is appreciable that MIR19A expression, it was significantly higher in gallbladder cancer as well as cholelithiasis. Since we are dealing with inflammation, and it is believed that cholelithiasis leads to gallbladder cancer, so we have included these patients as disease controls. So the MIR19 expression is higher significantly higher in gallbladder cancer and cholelithiasis as compared to controls, both in tissue as well as plasma. But the point to note here is that in the cholelithiasis patients, the expression is even higher than the cancer patients. So whereas in 146A expression, if we see, it was significantly higher in cancer patients as compared to cholelithiasis and controls. The levels were not that high in cholelithiasis. They were rather here, actually these are delta CT values, so therefore the lower means higher here. Lower the delta CT, higher is the expression. So 19A expression, 146 expression was significantly higher in cancer, whereas cholelithiasis and controls, they did not show any significant difference among them. So when we correlated the tissue expression of microRNAs with the plasma, we could identify that it is significantly positively correlated. Now the importance of this point is, we planned this study because as we had seen that 75% of the patients are unresectable. So they go to palliative therapy and it is very difficult to obtain the tissue from these patients. So we wanted to concurrent study tissue and plasma, that if there is any concurrence among them, there is correlation, that we can, yes, there is a proof of principle that even microRNAs can be used as a non-invasive test for gallbladder cancer patients. Then to identify their diagnostic potential, we did ROC analysis. And you can see similarly here also, A and C, they are microRNA-19A in tissue and plasma, and B and D are 146 in tissue and plasma. So here, the red line represents this cholelithiasis with the controls, and blue line is cancer with the controls. As we can easily see here, that in 19A, cholelithiasis showed area under curve of around 0.937, whereas cancer in the tissue showed 0.7, and in the plasma it went down to 0.4. So microRNA 19A in our results, it shows to have predilection for the cholelithiasis more than the gallbladder cancer. And in case of 146, it is clearly showing 0.97 was the area under curve for the tissue samples, and 0.8, around 0.8 for the plasma samples. So it has a very high discriminatory ability to identify gallbladder cancer patients as compared to controls. So here are the sensitivities and specificities based on the cutoff of ROC plots we had computed. And as we can see, the same thing. 19A is doing it represent very high sensitivity and specificity it had for cholelithiasis. It was good for GBC also, but 146A performed really well. So to summarize, microRNA 19A showed elevated expression in both cholelithiasis and gallbladder cancer as compared to controls. 146A was primarily elevated in gallbladder cancer. Now there are previous studies which are showing 146A to be anti-tumor than the pro-tumor. This can be explained with this slide, that as we had seen that multiple microRNA work on same protein, similarly a single microRNA works on many pathways, which can be pro-tumorigenic or anti-tumorigenic. So depending on the population, depending on the cancer, it might be, one of the pathway might be more active than the other. Another point that I wanted to summarize in this findings were that it can be used as a non-invasive biomarker. It is showing coherence between tissue and plasma. The limitation of a study was a small sample size, a single center study, and the major limitation was that most of the patients were in advanced stage. So we need larger studies where early diagnosis of this can be explained. And as we can see that 19A was observed in cholelithiasis and 146A in cancer, so there may be different pathogenic mechanisms that may be acting. Since microRNA 19A might be more involved in the inflammation as compared to cancer pathogenesis, and since we had only 30% patients with the gallstones, that could be a possible explanation to why it did show like this. So this was one of the chapters we had published on non-coding RNAs in gallbladder cancer. So we had explored the other non-coding RNAs as well, microRNA, long non-coding, and piRNA in gallbladder cancer, and it can be used for prognostic and diagnostic biomarker, potential therapeutic target, and also for promoting chemotherapeutic sensitivity. And here in our study, microRNA can be targeted as oncomirs, etc. And yeah, so they can be targeted multi-pathway. Just one statement, ma'am, I want to make over here. Inflammatory pathways are very important to be studied in cancers. FDA has recently approved low-dose aspirin for colorectal cancer. If something like this cheap, cost-effective thing can come up for gallbladder cancer, it can really help patients. Thank you very much, ma'am.
Thank you so much, Dr. Bela, for